Good afternoon, everyone. My name is Judy Blake, and I am with Family to Family Network in Houston, Texas. This, I must tell you, out of the year we have been doing this, Christina's my amazing colleague. This is one of our highest attended sessions, which is really, really fantastic. Almost 70 people registered. So the fact that we have 30 people or so on this webinar, I am very excited. So some of you may have registered in the last 5 or 10 minutes, which is why I did not have you on the list. So by the end of the week, I will be sending you the slide deck and the recording of this presentation. If for some reason you have not received it, please email me. I'll go ahead and put my, Christina, would you mind putting my email address in the chat box? Thank you.
I will.
And just email me and say, hey, didn't get the slide deck, didn't get the slides, didn't get the recording. So I know to email it to you. I know that email is not 100% and maybe it went to your spam or your junk folder. So if you have not received the recording by the end of the week, please do email me and I can make sure I go ahead and send that to you. So at Family to Family Network, for those of you who are new to this call, we are celebrating our 31st year. Yahoo, very exciting. I am the Leadership and Advocacy Coordinator. I also have my amazing colleague, Christina Zavala, on this call. And I also have another program coordinator, Inger Clark. Inger, if you want to wave. Yep, thank you, Inger. Inger has a fabulous program. I encourage you to look at our website. She works on financial planning for our families because we know how challenging it is to have a loved one with a disability, and we all know how costly it is. But for today, we have the amazing, the talented, the brilliant Lanisha Humphrey. She goes by Lynn, and she is with Health and Human Services. So she is sharing her time with us and her expertise today. So Lynn, I believe I've made you a co-host if you want to share your screen. So just to let everyone know, please hold your questions until the end. We will be answering questions. My hope is that we will be done by 1 o'clock. We may go a few minutes over, and if need be, your questions can always be emailed to Lynn and I will forward them to her. So just let us know if for some reason something was not addressed, and we will make sure that we get it taken care of. So Lynn, thank you so much for sharing your screen. And we are so happy to have you. Thank you. And Lynn, if you just want to unmute yourself and you can go from there.
Sorry about that.
No worries. Thank you for joining us today.
Thank you for having me, and it's a pleasure to be here and to be able to share with all of you the wealth and knowledge of this program, especially for disabled individuals that are pursuing workforce. My name is Lynn Humphrey. I have been with the state for 15 years this month. 10 of those years I spent in the MBI Medicaid Buy In for both adults and children. And the other 5 years I have spent with Medicaid for the elderly and people with disabilities. I'm with Program Policy for the state of Texas. And so this is one of our programs that we're going to share with you today. So Medicaid Buy In is a program for working individuals with disabilities who earn more than the allowable limits for regular Medicaid. MBI offers Medicaid healthcare services, including community-based services and supports to individuals with disabilities who work. Individuals must meet both a financial and non-financial criteria test. Eligible individuals may have to pay a monthly premium as a condition of eligibility. Medicaid healthcare services, MBI covers all the same medical healthcare services that regular Medicaid covers: doctor's visits, hospital stays, emergency care, vision and hearing screenings, prescriptions, glasses, speech, occupational, and physical therapy. Also, along with that, mental health care. The only thing that, the only few things that MBI does not pay for is it does not pay for any dental services. It also does not pay for any nursing facility stays, and it also does not pay for any institutional stays that may be required. So the non-financial eligibility criteria, an individual of any age who has a disability, are working, lives in Texas, is a U.S. citizen, or meets certain qualified alien status requirements, and does not live in a state institution or nursing home. The criteria for disability eligibility, an individual must meet the Social Security Administration's SSA definition of disability regardless of age. So this is not a program for individuals that are aged. It's only for those that are disabled. So it's not for anyone that's over 65. If they are over 65, they're going to have a Social Security disability. They may already have an established disability determination by Social Security, or they must have a disability determination established by Health and Human Services prior to an eligibility determination if they do not have one from Social Security. So we can't certify them for Medicaid until we get a response from our disability determination unit if they don't have a Social Security determination. And the only exception are individuals who are able to engage in any substantial gainful activity, SGA. They may still meet the disability requirements. For instance, I know that we have a lot of clients that come to us because they've been on RSDI, now they're working, they make too much money, and they're losing their Medicaid benefits. And usually the denial from Social Security for disability will say SGA. And so that's the only one that we take into consideration, and we give them a disability if this is the reason why they were denied Social Security. Eligibility for the financial. In addition to non-financial criteria, individuals must meet both income and resource limits. Only the applicant's income and resources are considered when determining eligibility. This is what we call a household of one. The MBI household is one person, the applicant. It doesn't matter if they're married, that doesn't matter. We are only counting the applicant's income and resources. So if they have a spouse and that spouse makes $150,000 a year and has, maybe a substantial nest egg, as long as it's in the spouse's name and it's not considered, and the applicant doesn't have their name on it, then we wouldn't look at any of their income or resources for eligibility. Income must not be more than 250% of the federal poverty limit. And for 2021, that's $2,684. But you have to remember, we give a deduction. So that income limit is actually after we give them a half deduction from their earnings.
And Lynn, not to interrupt you, I apologize.
Mhm.
I know that that's going to be like, okay, what is 250% of the federal poverty level? Could you give that number again, 21,000 something?
The 250% of the federal poverty limit is $2,684 per month.
Okay.
But we'll go into how we get to that, because we're
Perfect.
going to use the net earnings. We're not going to use we're not comparing that to the gross earnings.
Thank you.
And we'll go over that in a few slides. The resources must not be more than the current resource limit for the SSI program, which right now that's $2,000 after allowable exclusions. And we'll get into that. Eligibility income, their gross earned income minus allowable exclusions are compared to the FPL when determining eligibility. MBI allowable exclusions are the $20 general exclusion, $65 plus 1/2 of the remaining earned income. Earned income and child tax credit payments and disability related work expenses. So the earned income and child tax credit payments are the payments, if you have children and you know you're going to get the earned income credit at the end of the year, you can choose to get that paid to you monthly instead of getting it back out, all at one time at the end of the year. So that income that they're receiving is not counted in the budget. And then disability related work expenses, these would be our BWEs, our blind work expenses, our impaired related work expenses, passed through Social Security, and even just a few other things. So the eligibility for resources. MBI allowable resource exclusions include retirement related accounts, plan to self-support, which is the pass resource through Social Security, independence accounts, and then there's a $3,000 MBI exclusion. So to give you an example of that, if our client has applied, they're disabled, they're working, and they have a $3,000 savings account, and that's just their little nest egg they have, just in case they need, something happens. And then they have $1,500 in their regular checking account that's just their monthly bill account. So we would take the total, if those are the only two resources, we would add the $3,000 and the $1,500, which would make it $4,500. Then we would subtract the $3,000 MBI exclusion. And then their countable resources, we would compare to 2,000, which would be 1,500 compared to 2,000. So does that kind of make sense? It's not that their eligibility is going to be compared to 5,000. It's actually just 2,000. We just take 3,000 off the top. And then their monthly premiums. Eligible individuals may have to pay a monthly premium as a condition of eligibility. Monthly premiums are based on a sliding scale. They're calculated using both earned and unearned income, and may range from $0 to $500. So MBI has a cap. So if they have a premium over $500, it's capped. We don't like if their premium $730, we don't take that. We just take 500. So there's a cutoff for that. And then their monthly premiums, the unearned income premium amount is based on the amount of unearned income that remains after subtracting the SSI FBR, which is the current SSI income limit of $794. And then the earned income premium amount is based on the gross earned income minus any mandatory payroll deductions, which we call that the net income. And these are the three payroll deductions: income tax. So any of their income tax, FICA, Social Security tax, required retirement withholdings, we take that off of the gross income before we take the earned income premium. Those are taken off. And those required retirement withholdings, like if you work for the state, ERS makes you pay into them. You don't have a choice. And that's what these are as well. Any kind of retirement withholding they're paying into. So an example for the income premium is John gets $945 in RSDI and net earnings of $1,895. So we're going to subtract the federal benefit rate amount from the countable unearned income. So from the RSDI, which is $945, we're going to subtract $794. So John's unearned income premium amount is $151. Now let's look at his earned income premium amount. John's earned income premium amount is based on his net earned income of $1,895. So that means the worker has already went in there, gotten his gross income, taken out any mandatory payroll deductions, and this is his net earned income that we're going to compare to the limit. So if we look at his earned income premium amounts, we have this chart that shows the sliding scale for MBI premium payments. So can anyone tell me how much his earned income premium would be? He had a countable net income of $1,895.
I'm going to take a shot. So it would be the $20.
That's correct.
Okay, I
John's
could work
earned
with you,
income
Lynn. There
premium,
you go.
right? John's earned income premium is $20.
Yep,
John's
okay.
unearned income premium is $151. John's total premium is $171. Okay, let's
So
look at
you're saying
another one.
that's what it would cost him to have Medicaid buy-in, $171 a month.
Correct. Correct. Yes.
Okay.
You know, and sometimes people ask me, are there people that pay the $500? Yes, there are people that gladly pay it because they, I mean, we all know medical bills can get way outrageous. And so, yeah, people, when it comes to making sure that, they have health coverage, they do pay, that premium, and they probably get their money's worth out of it as well. Let's look at another example. Jane gets $1,306 in RSDI and net earnings of $1,560 a month. You subtract the SSI federal benefit rate amount from the countable unearned income shown below. The unearned income is $1,306 from RSDI. The federal benefit rate is $794, the SSI limit. So the unearned income premium amount is $512. If I were working this case, I would stop here and I wouldn't even process their earned income, their net earning income. I wouldn't even look at it. Does anybody want to take a chance and tell me why I wouldn't want to look at it?
Because 500 is the maximum premium amount.
That's correct. So because she's already at the maximum premium amount, we wouldn't really even address the earned income. So in next it says Jane's earned income premium amount is based on her net earned income of $1,560. You would see the earned income premium chart, but because Jane's earned income premium is $0, Jane's unearned income premium is $512. Her total premium is $512. But because of our cap, her total monthly premium cannot exceed $500. So she would have a $500 premium amount. These are some ways to apply. To apply for the MBI program, an individual must submit a form 1200 MBI application for benefits, Medicaid Buy In to HHSC. Applications can be submitted online through yourtexasbenefits.com. We also have an app or by phone at 211 or the 877-541-7905. Choose a language and then press 2. By mail, they can mail it into our Austin document center, or they can fax it into the document center at the fax number listed there. Or they can go into their local office and get an application and return it back to the local office. The application process. So after an application is received, HHSC makes an eligibility determination within 45 days for applicants who have an established disability through Social Security. So if they already have the established disability through Social Security, we work this just like we would work any other case. It's a 45-day window. It's 90 days for applicants who do not have an established disability. Again, we have to collect medical records, send those into our disability determination unit. It usually takes them a little while to get the doctors to review it and then get us a decision back. So that's why we get 90 days for those cases. HHSC will notify the applicant or the authorized representative, AR, of the eligibility determination. And the eligible individuals may receive MBI related forms such as Form H0043 and H0051 premium payment notice. So here's our eligibility notice. Once we let them know, okay, hi, Jane, your premium is going to be $500 a month. And let's say she wants, she doesn't have any prior medical bills or anything. She hasn't seen the doctor while she's been waiting to get on MBI. So we're going to start her MBI on the first day of the, if she pays her premium, then it could start either at the beginning of the next month or the first day of the following month. It depends on when cutoff falls. So it usually falls somewhere between the 12th and the 16th. So if they're before that date, if they pay their premium on time, they could get Medicaid to start the next month. But if it's after the middle of the month, the Medicaid won't start until the following month. And so that information will be displayed in the middle. It tells them that we received their premium payment and they are now eligible for MBI. To continue to be eligible for the program, you must make this payment monthly, and it has to be postmarked by November the 20th to be posted by the end of the month. And they will not take partial payments. And there's, they just don't take partial payments. They'll return it. They'll cash the check, but they'll return it to the client. So it's really important that they make sure they pay the correct amount. And then here's an example of a Medicaid Buy In premium payment notice. This is generated by our third-party vendor, Maximus. They send these forms out to the clients monthly. So when they make their payment, once they post their payment, and then we make them eligible in the system, then this notice is triggered once we certify them for another month. And if you'll notice, there is no month listed on the payment portion at the bottom. And that's just so that if a client needs to make a payment and they don't have their payment notice, they can use an old one they may have, or we can send them extra copies. That's why they don't put a month on there, because they're going to apply it to the oldest invoice first. And our premium payment center is in Dallas, Texas for both MBI and MBIC. Okay, and now request for information. So if an additional information is required to determine eligibility, we will send a Form 1020 request for information or action, and we'll send it to either the applicant or the AR. And the Form 1020 explains the additional information needed and provides a due date for the needed information. The requested information and required verification must be provided to HHSC by the due date. If the requested information is not provided timely, the application is denied. And so here's the Form 1020. It gives the client's information at the top, their case number. It gives them send us the items by, it gives them that due date in the middle. And then if we were actually looking at this notice, we would flip it over, and on the back is where the worker would write exactly what they need. They would, might write in a paragraph or list out what it is that they need. And then the renewal process. After an individual is determined eligible for MBI, their eligibility must be redetermined at least once every 12 months. And that's only for the financial and non-financial eligibility. Their disability, if they have a disability through SSA, it's permanent. But if we give them a disability and it's not permanent, we can give them conditional disabilities. Let's say someone has a disabling factor, it's going to last longer than 12 months. But there is a chance that the person with therapy or surgery or whatever, the individual could no longer have the disability, or the disability wouldn't be as severe in the client's activities of daily living. So for instance, let's say someone may have a form of cancer, and they could get chemo, radiation or something, and overcome the cancer. It could be it can be quite a very vast difference of different disabling factors. So they may have to do a disability review, but the minimum I think they give on those is 3 years. So I think the minimum is 3 years and the most is 5. So they'll have a review between those two timeframes. And the renewal forms are mailed to the recipient or the recipient's authorized representative, AR, at least 2 to 3 months prior to the renewal date. We're sending these out now at 3 months. So if they have a review due in January, they're sending those out in October. So, yeah, make sure, you know, that they know that it's a 3-month, that we start sending forms 3 months prior to their renewal date. It must be completed and returned within 30 days. And if not returned timely, benefits would be denied. And we usually, the 30 days, we usually don't go by that. It's just the sooner you can get it in, the better. But the 30 days is when they want us to get it done. But here lately, it's been maybe the month before their review is due. So like if it was in January, it might be December that they have to have it in by. And again, if it's not returned timely, benefits would be denied. So here are some application tips. When completing an application or renewal form, answer all questions. If a question doesn't apply, indicate not applicable. Provide copies of bank statements, check stubs, Social Security award letters, life insurance policies, etc. So what I tell my clients is if you answer yes to any question, you need to provide proof. So if you say, yes, I have a truck, then you need to provide us with proof of how much that truck is worth, who owns that truck. If you have a bank account, you know, show us a bank statement with, you know, who owns that account, who shares that account, what payments go into that account. So they just have to provide proof of anything they answer yes to. And then make sure you always sign and date the form, because unsigned applications will be returned. And if it's, you know, if you're trying to get 3 months prior and you're trying to get in, you know, at a certain date so that you're not missing anything, it's really important to make sure they're signed, because they're not logged in and they're not filed until we get the application signature. So, and sometimes just a few days can mean, you know, being in a whole new file month. So instead of getting a file month in September, you could end up getting one in October, and that would change your 3-month prior window. And then return all requested information timely. Signing the application, anyone can assist an individual with completing an application or renewal form, but only the following may sign an application or renewal form: the applicant, the authorized representative, or someone acting responsibly for the applicant if the applicant is incompetent or incapacitated. The following individuals are responsible for signing the application and renewal forms and for providing information to HHSC: a legal guardian, power of attorney, parent or parents of a minor child, other family members acting responsibly on the applicant's behalf. And note that individuals may also designate an authorized representative to act on their behalf with all agency matters. The AR is someone who is knowledgeable of the applicant's financial matters, can provide information necessary for the eligibility determination, and agrees to act responsibly on behalf of the individual in all matters with the agency. So an example, we have a client and they need someone to help them with this information. Maybe they can't read, could be anything. So an AR, they would want to make sure maybe they don't have children. Maybe they have a nephew that they're close to, a niece, a friend, a neighbor, someone that's willing, that knows the client's financial matters and can provide the information. So, I mean, if you can't, if those are things that the authorized representative doesn't really know or can't do, then they shouldn't be signing the form, because that's actually going to make them responsible. Let's say down the line, we find out that they had a bank account that wasn't reported and it makes them ineligible. Well, the person that signed the application or the authorized representative is going to be responsible for that. And the AR designation remains in place until the individual notifies HHSC that the AR is no longer authorized to act on his or her behalf. The individual designates a new AR, or the AR notifies HHSC that they no longer wish to act as the individual's AR, and the individual can only have one active AR at a time. And then for additional information on MBI can be found in the Medicaid for the Elderly and People with Disabilities Handbook. And when you get sent this PowerPoint, you'll be able to click on the link and go into the handbook and look at it. And Medicaid Buy In is Chapter M. And then
Was
the
that
1200,
Mary? Oh, chapter M, you wrote it there.
Yeah.
Okay, thanks.
the 1200 MBI, applications for benefits Medicaid Buy In, can be found in the forms section of the handbook. So our handbook is really nice. It's been updated by program policy. And like if we click on it and I go to the handbook, okay, that's not gonna work. But if I go and open the handbook, you'd see that it's really user friendly now. And we have lots of outside entities that use our handbook quite often. And then notice of policy updates. To sign up to get notices of policy updates and changes to the Medicaid for Elderly and People with Disabilities handbook, you can subscribe on the HHSC website or through HHSC's Gov delivery service. You would just enter your email and notification preference, and on the next page under subscription topics, scroll down to meetings, news, and research, and select HHSC eligibility policy handbook updates, because we make updates quarterly, every year, every 3 months. So if there's any new legislative changes or government changes or even federal changes, you'll get a notification letting you know what the old policy was and what the policy is going to be and when it begins. And we can just open it up for questions if anybody has any questions.
Lynn, that was terrific. Thank you so much. You tried to give us some clarity, some clearness, to a very complicated system, as you know.
Yes.
Yes, we do have several questions. And for those of you who signed in late, I will be sending the slides and the recording to y'all by Friday. If you haven't received it, please email me, judy@familytofamilynetwork.org, to say, hey, I attended your session and I didn't get the slides and recording. Because some of you who have phone numbers and everything, I can't tell who you are. Or maybe you just registered, maybe you used your initials, maybe you're using your kid's iPad. So make sure that you email me, because I want to make sure that you get this really, really important information. So no, this was really great, Lynn. Thank you so much. So I'm just going up to the questions, and there are several. Okay. I'm just scrolling down, my apologies.
No, that's okay.
Okay. This is a great question. Well, they all are great questions. What ages are they able to get buy-in? What if not old enough to work? Would they still qualify, or is it based on family?
No, you have to remember it's any age.
Any,
And it's
okay.
any age. They just have to be working.
They have to be
And
working. So what if you have a child and the parent makes maybe $75,000? And I'm just throwing that out there. This person didn't mention that.
well, that's something that we really need to go into a little more in depth, because it says it can be any age. But technically, I don't believe, and this is something that I'm glad they asked this question, because now this puts it at the forefront of my mind, because we've actually had problems where we can't get the child on MBI. Like, for instance, a 14-year-old disabled and was babysitting every weekend. It's just a little job she had. Okay, well, she was disabled and she was working, because we used to require, well, the federal government let us know that we were wrong. But when we read the policy, we thought that, because we used to give MBI if they were aged over 65 or disabled. And then that's when the federal government came back and said, no, you're doing it wrong. They can't be aged. They have to be disabled. Well, then we also were told they could be of any age and they could be working. So we actually had an issue like this. It was a 14-year-old. She was disabled. And again, her parents made very good money. And so that's why she wanted to be on MBI.
Okay.
but we couldn't put her on MBI because she was under 18 and had a disability. It was trying to give her MBIC. So that's something that I'm actually going to write this question down.
Yeah, and so to the
Because-
person who asked that, could you let us know how old the child is? Because it sounds to me like maybe you applied, your child does not work, and maybe you were told the parents make too much. Is that what can happen, Lynn? Because I've had other other
Yes.
people tell me that.
Yes, like for instance, this child, she would have been eligible for MBI because it's a household of one. So we
Mhm.
wouldn't looked at her parents' income, her
Mhm.
resources or anything. And she was working and she was disabled. So she only, she wasn't getting any RSDI. She was only getting, I think $75 every weekend
Mhm.
to babysit.
Mhm.
And so, I mean, with the way policy is, laid out, she should have been MBI eligible. But again, they came back and said no, that she had to be on MBIC. So we really need to, that's something that we need to take back to the feds to find out.
Right.
Okay, so where is the line here? Because
Right.
we can't do, you can't do one, you can't do both. You have to do one or the other.
Right.
So,
Yeah, and if that did not answer your question, to the person last name Dyer, please let me know in the chat so we can ask a follow-up question to that.
would you actually mind emailing me that question? Because I
Sure.
actually,
Christina, can
I'm
you
working
copy and
from
paste it
home.
for me so I can go on to the next question? Yeah, no problem. Christina will copy and email it to me and I can
Okay.
forward it on to you, Lynn.
Okay.
Yeah, it's so confusing, these policies. Next question. What is the income guidelines for MBI for children? So again, that's where we're,
For children, we count the parents' income.
right. Okay.
And so that is actually a beast of a whole different,
Right.
it's nothing like MBI, except that they have to be a child and they have to be disabled. That's it. Parents can work or not work,
Okay.
but it's
not the 250% of the federal.
no, and it's based on, it follows food stamp
Okay.
eligibility. So it goes by how many people are in the household.
Okay.
And and I actually have an MBIC presentation. So
What's
if you ever need me to
MBIC?
come back, Medicaid Buy In for children.
Oh, okay.
Yeah. So if you ever need, we can do a presentation over that.
I will be booking you
my
for
program.
2022.
That's my
So Christina, remind me of that. So you have a presentation for, okay, good to know.
Yeah.
Good to know. So to Carolina, who asked this question, I'm sorry we weren't able to answer it, but is it reasonable to say if you are a couple and you have a child and you make maybe $50,000, but you don't get health insurance through your company, that you might make too much for your child to qualify for MBI?
Let me see. I'm going to show you like what our chart looks like. Hold on
Okay.
just a second. Let me pull it up here.
Sure.
A lot of interest in that MBIC for children.
Yes, a lot of
Yes,
interest, which is
it's
really,
a great
yeah.
program, especially for people that make not a lot. I mean,
Mhm. And I think maybe that's what I thought this was more of. So my apologies to the group.
no, that's okay. So here is our MBIC chart for 2021. Let me just, my
Sure.
computer's slow.
Could you send that to me? Can you email that to me so I can?
I sure can. I will. It's changed every March.
Mhm.
We give an income exclusion just like MBI of 85 and at 1/2 of their remaining income.
Okay.
Now for eligibility, they have to meet the 150% FPL and no more than that limit. So let's say it's a family of 3, mom and dad and the child. So it's $2,745 a month. Hold on just a second. So if you take for a family of 3, pardon me, if you take the family of 3, it's $2,745. And I'm going to multiply that by 2 and then add 85 back. So the gross income for that family can't be over $5,575 a month.
Okay. So if you send that to me, I'm going to forward that on
Okay.
and to the group, be posted, because in 2022, I guarantee you, Lynn will be back.
Yep. I'll
And
be
to
here. I'll be here for a
Carolina,
long
I'm
time.
sorry if that didn't answer your question.
Yeah, but
but-
this is found in our handbook as well. So I
Oh,
don't,
it's in the handbook. Okay.
yeah. And
Okay.
but I'll send these to you because I make my own that are cheat sheets. So
Sure.
this
Perfect.
is just a one pager. Yeah. So I'll
Love it.
send you those. That's no.
So
So
someone had,
now, I'm sorry, Judy, now that we're going over this, Tammy's asking if for MBI for adults, the disabled person needs to be employed, right?
Correct.
She's asking, correct.
Right
Okay.
now,
Yeah,
but
it's just-
we used to say it, again, the feds came back and said, no. We
Mhm.
used to do it where you had to have a job that was paying into Social Security. If you didn't, you weren't working. Now we've been informed that that's not true, that working can be anything. They can't, like this girl that I told you, she babysat on the weekend.
Mhm.
I have a grandfather that's, he's a paraplegic and he watches his grandkids get off the bus because his grandkids live next door. So his job is every day he watches his grandkids get off the bus,
Mhm.
and his daughter pays him to make sure they get in the house and that nothing's going
Mhm.
on. So I mean, you can sell things on eBay. You can
Got it.
make crafts and sell those. You just have to be working in each calendar month, and there's not a minimum. So I mean, if you work an hour,
Mhm.
then
You're
that's
working.
fine. Yeah,
Okay.
there's no minimum and there's no maximum either.
Got it. So the question was, what is RSDI? And someone had answered Social Security Disability. Do you want to clarify that?
RSDI stands for Retirement Survivors and Disability. So RSDI, Retirement Survivor Disability Income, pays those that are retired at retirement age 65, or you could take early retirement at 63. It's for those that are disabled and have paid into Social Security and can get an RSDI check. Just because they get an RSDI check doesn't mean that they won't qualify for SSI. If they don't meet that $794 SSI limit, then they would get the difference between the $794 and their RSDI check. And then it's also for survivors. So if mom and dad are married, they have 3 kids, dad's killed in an accident, then those 3 children would be eligible to draw off of dad's Social Security as long as mom is not making over a certain amount of money. So
Thank you.
those are the incomes covered by RSDI.
And RSDI is a whole nother, that could be another
Yes,
webinar.
yes.
So
Yes.
another great question, if they miss payments, will their benefits end immediately or are they given extra time? I guess I'm asking how far behind can they be with their bill?
So when they miss 1 month, we send them a notice and we
Mhm.
tell them that they missed that month. If they have 12 days to pay, if they don't pay within that 12-day window, their benefits will end the month following the one they have not paid. So if they
Okay.
didn't, let's say that they didn't pay for September, okay, but they got September benefits. So we get to
October.
no, we get to the end of September
Oh.
and they haven't paid in that 12-day window,
Mhm.
then their benefits are denied starting in October. What has happened in the past is they'll reapply
Mhm.
and then they'll think, okay, well, we tell them, okay, you're eligible for those 3 months prior. And they're like, nope, don't need it. Just let me have the ongoing month. But they have to pay that month in September. They got coverage that they didn't pay for.
Exactly.
So when we send them a notice, we would send them a notice telling them, okay, to get coverage, you have to pay $150 for September that you missed, that you got coverage, but you didn't pay for it. And then you would put the ongoing month after that because they wouldn't get the ongoing month unless they paid the prior
Okay.
month as well.
The
Yeah,
prior month.
So you have
Okay.
to pay up before you can get to the next month.
correct.
Right.
Okay.
So they
Judy,
can
if I may, I'm sorry.
only get 1 month without
Mhm.
paying.
Got it.
Right, exactly. Got it. Okay, at that point, there was another question sent to me. It's What should the LAR do if the monthly premium was returned, and who will they contact?
So if the client pays, let's say the client pays the premium of, let's say it's $400, and they sent in a payment for $395. And so they're missing $5. What happens is that check is cashed.
Mhm.
Our payment vendor sends a letter to the client or the AR, whoever is responsible for their case. And it lets them know that we received a payment of $394 or $395. This will be held for 12 days pending refund unless you send in the rest of the money. So if they, so then they would have, they would probably need to send that $5 in pretty quickly. And the fastest way to get the money to us is to overnight it. And for you to overnight an MBI premium payment, it costs $20, $19.95, I think. So yeah. So that's why it's really important that they try, and that they make sure they use their coupons, because what's on their coupon is what they need to send in.
Oh, okay. And her same person next question is what number they need to call for that. I think you put it there, but she missed it, or you mentioned the number, but she missed it.
Yeah, unfortunately, right now we can't take automated payments or anything, so there's no one for them to call. They would have to mail it in. Now you can always call the local office, and they can have someone help you with your case and let you know, when to send it in. But the MBI address is on all of their stubs for sending in payments. So yeah.
And you're
Okay,
talking about the local Health and Human Services office.
Correct.
Yeah.
Correct.
That would be it. Okay, perfect. Yes, Judy, that's the two questions that I got privately.
Thank you. Thanks,
Mhm.
Christina. A couple more questions on my end. If a client is approved for MBI, will they get traditional Medicaid, or will they have to select one of the Medicaid HMOs?
So currently HHSC is operating all Medicaid in the state is operated by one of several healthcare organizations.
Mhm.
When you start out on any Medicaid program, you're in traditional Medicaid. TMHP is coverage for 3 months prior,
Mhm.
and it's coverage for up until the first month of full Medicaid
Mhm.
after certification. So let's say, okay, I applied in September and I was approved in October.
Mhm.
And let's say I was approved today, October 20th. It's too late for me to get Medicaid beginning 11/1 with an MCO because it's past their cutoff date for new enrollment. So that means if I needed let's say I needed 3 months prior, I needed August, July, and June. So June, July, August, September, and October, and November would all be paid by TMHP. So you would have to file any those back bills that you had, or you had a surgery you needed paid. Those would all be done by TMHP. Beginning December 1st, they would be with managed care, and they get their enrollment packet within 2 weeks so that they're able to pick and choose their MCO.
And what is TMHP again, please?
Texas Medicaid and Healthcare Partnership.
Okay.
They are who now TMHP was who used to manage all Medicaid in Texas before we brought in the
Amerigroup and United. And okay.
Yes, correct.
Okay. Can you tell me if there are copays at doctor offices while on MBI?
No, there are not. If they pay their premium, their payments are made at 100%. And that is, of course, the stipulation. They have to use Medicaid providers. So they would have to use in-network providers. There wouldn't be anything paid out of network.
Okay. So a woman asked, so her 7-year-old would not qualify for Medicaid buy-in, or again, that goes by the parent's income?
Correct. Now, if that disabled child isn't working, and I don't know anyone whose 7-year-old is working, they would have to qualify for Medicaid buy-in for children, and that would depend on their parents' income. But the good thing about Medicaid buy-in for children is we don't have a resource test. So we only look at the parents' income. So if the
Mhm.
parents have money saved or IRAs, we don't mess with that. We don't look at that because that's all money they've saved. It's not income. And so we're just not going to mess with that.
Right, and the challenging part is parents who make just above.
Correct. Yeah,
And it is,
that's always the hard.
it's
Uh-huh.
very, very challenging
Yes,
for families, because those are the calls that I
is.
get, and it just breaks my heart.
It does me too. And I tell them, I tell them if I could give it to you, I would. I
I would,
understand.
you're following yeah, no doubt
My
about it.
sister has a chronically ill child, and she and my brother-in-law make decent money, but
It's not enough
they
when you
have this
consider the
chronically
cost of
ill
living.
child, and they live month to month. believe it or
I
not.
have no doubt they do.
Yeah.
MBI for adults, does the disabled person need to be employed? And
Yeah, that was a
then-
question that we already did. And then the next one she made
Oh.
is, can MBI be used to get Medicaid for the Medicaid class waiver?
Yes.
Mm,
Can use MBI for class. That's another good thing. Is because class you have to come with Medicaid, in hand. And I have certified hundreds upon hundreds of clients that were just getting MBI to get class services.
mm,
Mhm.
mhm.
So that's not unusual. That's they do that a lot. And
Hi, this is Tammy. I'm going to jump line a little bit because this
Sure.
is a real issue with the Medicaid class waiver system. I want to share with you that I know of a case where an adult was receiving Medicaid through SSI. The parent retired. They got SSDI and Medicare, and they kicked the kid off the waiver program because the kid didn't have Medicaid anymore. In my son's case, Social Security is not considering him disabled. We're in appeal.
mhm.
So is there a different process to qualify for a Medicaid buy-in that does not require him to receive Medicaid through Social Security? Or because if the federal government through SSI deems him not to have a disability, does that also kick him out of Medicaid buy-in like it does for Medicaid for individual, elderly individual, and an individual with a disability?
Well, if he was on SSI, he has a disability.
He was not on SSI. He was denied SSI.
Oh, okay.
Oh, I thought you were saying he was denied SSI due to the startup of his parent.
That's what I thought.
RSDI.
Yes,
Yeah,
someone was on SSI and Medicaid. This is from the Easter Seals case manager.
Mhm.
So she's managing my case and she's managing this other case. And this is heartbreaking to me. Actually, it's not even heartbreaking. It's horrifying to me that this individual had SSI Medicaid. So this grown adult who was disabled, the grown adult who was disabled's parents retired. So they moved this individual to SSDI and Medicare. The state of Texas came back, HHS, and said, oh, you don't have Medicaid anymore. Therefore, we're denying your class waivers. So what you're telling me is this individual, then I can tell the caseworker at Easter Seals that, yes, she can use Medicaid buy-in to get Medicaid to restore the class waivers. So
As long as she's working and she, like the one you're talking about now, that's what
now,
happened.
so the original one is my son. My
Uh-huh.
son, after 14 years, came off the class waiver. We, at the same time we were applying for Medicaid for the class waiver, we're going through the SSI process. He was denied SSI.
Mm.
Therefore, he didn't get Medicaid. And the state of Texas told us, well, he didn't get Medicaid through SSI, therefore he can't get the class waiver. So now what I'm trying to decide is, can I buy into the Medicaid waiver, put him in a job, buy into the Medicaid waiver to get his class services? But will they use the same bar for disability for Medicaid buy-in that SSI uses?
Okay, so what we do, our disability determination unit does use the Social Security standard and definitions. I don't know this for sure because I don't know how Social Security does theirs, but I know how we do ours on the HHSC side. The more medical records that you provide showing the detriment and the activities of daily living for that individual, because we actually have doctors that review these medical records. So, and like I said, I don't know the Social Security part. I don't know who looks at them. I don't know how they come up, if they just have a standard that they have to meet.
Well, the state of Texas HHS denied him, and the denial letter says that he was denied because they could not overrule the Fed's determination of
For
not a
90 days.
significant. Yeah, no, they would not until I had a resolution from SSI. So if I win my appeal, they'll buy it. If I lose my SSI appeal, which I will, because I consulted a law firm and they told me I had no chance in hell of this kid getting SSI. So basically what this means, because he does not qualify for SSI criteria for disability, it also means that in the state of Texas, they will take that SSI definition and I can't get Medicaid for a person with a disability, so I can't get his waiver. So what I'm asking you is, does MBI use the same criteria? If he's denied by SSI saying that he does not have a significant disability, will you also deny him MBI?
Well, not technically, because we use the same disability determination unit for all Medicaid programs. Here's my question. What did the attorney tell you was the reason why he won't get it? He won't get the SSI.
Sorry, Tammy, I unmuted you by accident.
So the attorney, which was one of the two actions that Family to Family had recommended, but a colleague at the oil company I worked for, who's is head counsel for the corporation, also recommended this firm. They told me that they looked over all the documentation we had, the psychiatrist, all of the evaluations. I've had this kid evaluated from all the major medical centers in Houston, and they told me that he would not get SSI because he is in college, community college. He has not attempted to work, and until he attempts to work and fails at work, he has an autism spectrum disorder. They will deny him SSI.
Yeah. Now that, I mean, I wasn't sure if maybe they were just thinking income, but I mean, I don't really know about that part.
Can I jump
Yeah.
in on that one?
Yeah, and
I
then we're
do
gonna
know a
need to
little
move on
bit,
to the other question.
So what I'm trying to tell you guys is what I'm trying to convey is there's a real mess with the Medicaid class waivers and the Medicaid portion of it. I'm really thankful I came to this because I can go back now and tell the woman at Easter Seals that yes, this poor
Okay.
woman whose child lost her waivers because she's getting Medicare, they can do a buy-in through Medicaid and she can get her class waivers so in my case, you know, I don't know. It seems like Medicaid.
Well, let me give you an option
Can-
first, because I want to give you an
Okay,
option
And
before we
then we're
get
gonna
off.
need to move on to other
Okay.
questions.
So here's the option for you. Once the appeal is done, don't stop the appeal, let it go through. Once they make their final decision, okay, he's not eligible, bam. Let's say they give you that disability. They say he's not eligible on November 1st. You have 90 days from November 1st that HHSC cannot take any action on that case at all. It's like for 90 days, we can't do
They did
anything.
already though. He's in appeal. He has a scheduled appeal date and they still denied him. They denied him in July with an appeal in process.
Okay. But like once the appeal is finally done, once you're done, you've exhausted all your appeals.
On
and then
January
you-
4th, yes.
Okay. So once you get that, if that's your final denial, 90 days from January 4th, you can apply. If he's working, you can apply for MBI and we can get a disability determination that way. And because you said, you know, he's not working, he hasn't tried to work and fail at it, that if those are in the documentation that you send to HHSC for medical records, that's going to be taken into account. So that's what I'm trying to say is that HHSC has a little more leadway because with Social Security, your disability is permanent or not. You either are
Okay.
permanently disabled or you're not enough.
Yeah, it's binary. It's either on or off. Okay.
Right.
That
Okay.
piece I did not understand. Okay.
And with us, we can give you a 3-year.
Can I add something?
Quickly,
go ahead.
because we have other questions. Quickly,
Can I add something?
quickly, yes.
Also, if you need to define the service Medicaid and the justification need for the SSI. Even though it's a work thing, but they need to reason why they need service met the most. So justify why you need the Medicaid to help some in in the community.
It's
'cause he
already been
couldn't-
done by
because he
East.
couldn't get a job,
It's
couldn't get
already
a
been
job
done by
without the
Easter
job, without
Steels.
the
Easter
support, the
Steels
support.
Okay,
already went through the assessment.
ladies, both of you are talking over each other. If you want to email each other, that would be great, but I do need to move on. I apologize. So another question, how does MBI work with waiver programs? Do they pay for dental therapy or medical equipment?
They will pay for medical equipment. Let me say they can pay for medical equipment. Of course, it has to be justified as medically necessary.
Mhm.
But there is no dental at all, no dental therapy, no nothing, no
Okay.
evaluations. Texas only has Medicaid for dental for children, and that's it.
Okay. To qualify, is the income guidelines for the parents different, meaning higher, lower, the same from MPI than regular Medicaid's income guidelines?
Well, because this follows the food stamp
Oh, right.
income, then no, it's not much different, but it is different in as how much of a deduction we give at the beginning. Because remember, we take that gross income, we divide it in half, we minus 85 and then divide it in half.
Okay. And more people do want information about the Medicaid Buy In program for children.
Okay.
Where can they get that information, or do you want to send me the link and they can sign up?
I will
for
send you
your-
the information in the email. And
Yep.
like I said,
They can
just
sign up
whenever
for your
you
webinar.
schedule it. Yeah, whenever you schedule it, I'll be there.
Well, but what about if they want information beforehand?
Oh, I'm gonna send it. I'll send it to you in the email. And I
Okay.
send you the PowerPoint and
Okay.
everything.
So to everybody, make sure I'm still on. I have your email. And if you don't get it by Friday, please email me.
Mhm.
And I so appreciate, one quick question. MBI does not cover any therapy?
It covers physical, occupational, and speech therapy.
Okay,
Yeah, I mean, it's just like regular Medicaid, as long as it's medically necessary. They will, they will definitely, and they'll know beforehand. It's not like they'll get the adaptive aid or any, and that's another thing. It pays for adaptive aids.
okay.
I mean,
Meaning
yeah, I
an
mean,
iPad or something like that?
yeah, or even like I have a lady that's a complete quadriplegic,
Mhm.
and like she works and she uses a sensor that is on the
Oh,
sense of
right,
her
in the
nose.
eye. Mhm.
Yeah, and she's able to work on the computer. So
Okay,
yeah, it definitely is. Yeah, it's definitely possible.
okay.
I was the one that asked that question. So can I ask, so it doesn't cover any type of mental health therapy?
It can, because we do cover mental health services. Yes.
Okay,
Great question.
great, thank you.
Did I get all the questions in the chat box? If I didn't, you can unmute yourself. I want to make sure that everybody's question was addressed. And I apologize for cutting you all off earlier, but I had to move on to other questions. I know this is very, very complicated.
Mhm.
And again, I'll have my contact information in the email I send to Judy.
Yeah.
And you're more than welcome to reach out to me, and definitely, I mean, I'll help you in any way I can.
Thank you. Lynn, this was great.
Thanks.
This was great. If you want to stop sharing your screen. Thank you so much. I know this is very frustrating for some of you. It is not an easy process. We're trying to open the door for help. And Lynn, you allowed us to do that. So I thank you all so much for joining us. Please make sure that you complete the survey. And we would really appreciate you doing that. And Lynn, I will look forward to your email. And thank you for allowing me to share your email so people can reach out to you.
No problem.
Okay.
Y'all have a wonderful day, and thank you for having me.
very much. We
Thank
appreciate it.
you.
Christina, if you could stay on for just a moment.
Sure, thank you all.
Thank you, Callie.
Bye-bye.
Thank you all.
You.
My pleasure. Our pleasure, Shalandra. Okay.
I ended up removing a couple of people.